You know that your child is in the best hands here, and you trust that the doctors know what they're doing. But what exactly that is, you're still not entirely sure. And that's no surprise. After all, it's hard to understand. That's why there will be a conversation with the surgeon who will be treating your child. He can answer all your questions. Then you'll not only know what to expect, but ideally, you'll even feel a bit more reassured than before. It can happen that the surgeon suddenly appears at the door and says, "All right, I have time now. Would you like to come with me for a moment?" But maybe you're sitting with your child, reading to them, or watching a movie on the tablet, or perhaps only one of you is there at the moment. In short, it's really not a good time right now. And I want to assure you that it's okay to say so. Ask for a different appointment. There's no point in going into the conversation completely flustered and ending up with even more questions than you had before. So, if you know exactly when the appointment will be, you can sit down and simply write down your questions. That helps ensure you don't forget any of them. Maybe you'll be glad to have a few extra ideas. That's why I have a few for you. So, what are good questions? For example, could you please explain the operation to us in simple terms? In other words, how exactly does the surgery actually proceed? And a little tip, if it's a tumor operation, don't hesitate to ask the surgeon about the MRI images. If he uses them to explain things, it often makes it much easier to understand exactly what he means. The next question is, what happens if our child doesn't have this operation? And the question, what are the alternatives to this operation? That's always a very good one as well. Then, what are the risks of the operation? In other words, how dangerous is the procedure actually? Or also, how many of these operations do you perform here each year in this center? So just to understand, is this a common surgery or is it a rather rare surgery? That always helps quite a lot as well. And then, how long will our child actually have to stay in the hospital afterwards? The next question is also very important. Will the operation be performed under general anesthesia or in some other way? How long will the operation take and when will we be able to see our child again afterwards? Will our child have to go to the intensive care unit afterwards? For larger procedures, this can actually be necessary for monitoring. It's good to know that in advance. And then of course, can we go to him or her there? And how soon? And what can we actually hope for from the operation? I think that's a really important question. And of course, it's important. What should our child do or not do after the operation? In other words, what should be avoided? And how severe will the pain be after the operation? But it's also important. From when will our child start to feel fit again? So for example, to play or go to school. And what problems can occur after the operation? So not necessarily during the operation, but also afterwards. What do we need to watch out for then? That is, what can we do if these problems should arise? And what can we do to prevent it from getting that far in the first place? It would be good if both of you go to the conversation together, so mom and dad. If that's not possible, or you're a single parent, then grandma, grandpa, a friend, an aunt, or anyone else you trust can also come along. You can also take a few notes during the conversation, jotting things down a bit. So that means you write down the most important things. Bring a small notebook or a few sheets of paper. That way you don't have to rack your brains afterwards and ask yourself, what exactly did he say again? Or how exactly did she mean that again? So you don't have to think or worry about whether you really understood or remembered everything correctly. And otherwise, it's really important to know there are absolutely no stupid questions. You are allowed to ask anything and to ask again and again. You don't have to make a good impression there. And you don't have to be embarrassed if you don't understand what the doctor is saying. It's completely fine if you say, "Excuse me, could you explain that one more time?" And if there are still questions left afterwards, then simply ask for another conversation. The more you know, the less you will worry. Simply because you have a good idea of what will happen to your child during the operation. That will help you stay calmer so you can fully focus on your child. And that is, after all, the most important thing.